Hello. Good afternoon, pharmacy.
Yeah, it's nice to meet you.
Yeah.
I'm pharmacist Lee. May I have your name?
I'm Bob Lee. Bob Lee.
Oh, Mr. Lee. All
Yeah.
right, Mr. Lee.
Yeah.
Before we start, I need to verify your identity first then.
Yeah.
May I have your IC card?
Pardon?
IC card. I need to verify your identity. It's okay.
You show me?
Okay. I will. Oh, let's get a fist bump. Yeah, fist bump. Yeah.
Yeah, big bro.
Okay, we have a tacit understanding now.
Uh-huh.
So back to the point. What can I do for you?
Yeah, I just came along with the new prescribed medication.
Oh, I see. Got it. Before answering your question, I would like to ask you some simple questions.
Okay.
Not to be a little nervous. Just take it easy.
Okay.
Okay, question 1. What kind of family history do you have? High blood pressure or diabetes?
No.
All right.
Okay.
Question 2. Are you allergic to any kind of medicine? Sneezing or itchy or some kind of that?
No.
No?
No.
All right. Do you keep a regular daily routine and sleep schedule to stay healthy? Regular daily routine and sleep 9 o'clock.
What do you mean? What do you mean?
Just sleep 8 hours every day.
Yeah, because I know any idea about how to take medication, so that's why I just come to ask you. You just give me some information about it.
Okay. Next, I will preliminary just introduce these drugs. The first is called Pce.
Yeah.
First, I will introduce its uses. This medication is used to prevent or treat gout attacks. Usually, gout symptoms develop suddenly and involve only one or a few joints. The big toe, knee, or ankle joints are most often affected. For example, Mr. Lee, you have been affected by your toe joints. Yeah, and gout is caused by too much uric acid in the blood. When uric acid levels in the blood are too high, the uric acid may form hard crystals in your joint. So you now have crystals in your joint. Yeah. And how to use this medicine? Take this medicine by mouth and 3 times a day, 1 tablet at a time. All right. And what is the side effect? Diarrhea, nausea, vomiting may occur. Yeah. And what if we overdose it? Symptoms of overdose may include severe diarrhea, abdominal pain, trouble breathing, weakness. And how about Indoi? The next drug is used to relieve pain, swelling, and joint stiffness caused by arthritis, gout, and how to use it. Take this medication either with food, right after meals, or with antacids to prevent stomach upsets. Besides, 3 times a day, 1 tablet at a time. It's same as the colchicine. Yeah, and the side effect is upset stomach, heartburn, headache, and drowsiness. How about overdose? Symptoms of overdose may include severe stomach pain and vomit, looks like coffee grounds, and extreme drowsiness and confusion. And maybe a little terrible. And the next drug is Faburic. About Faburic is that it used to lower uric acid levels in people with gout. And take this medication by mouth with or without food as directed by your doctor, usually once daily, half tablet at a time. It's different from the two kind of drug. Yeah.
Yeah.
And side effect is nausea may occur. And if someone has overdose, will cause serious symptoms such as passing out or trouble breathing. A little bit horrible, so you need to pay attention on that. The precaution is if any of side effects last or get worse, especially liver damage or serious allergic symptoms like rash, tell your doctor or pharmacist promptly. And remember that these medications have been prescribed because your doctor has judged that the benefit to you is greater than the risk of the side effect. So benefit is higher than the side effect. So the doctor will recommend it with you. And to be pay attention on it is that alcohol can decrease the drug effectiveness. So limit it while taking the drug. So no alcohol.
No
All right?
alcohol.
Yeah. And what if we miss a dose? If you miss a dose, take the middle point of the two doses, so the middle one, and take the supplement if it is not exceeded. If you are too lazy to count, just skip the missed dose and take your next dose at a regular time the following day. So do not double the dose to catch up. So no double dose. All right?
Okay.
Yeah. And how to save it? Store at room temperature away from light and moisture. Keep all the medications away from if you have children or pets or cousins. Properly discard this product when it is expired or no longer needed. And the matters needing attention is that about colchicine, due to the outbreak of coronavirus, everyone know that it's very serious. Some doctor will prescribe antiviral drug like Paxlovid. However, it will interact with colchicine and cause arrhythmia. It's very very serious. So it is important to tell the doctor before you take any medicine. You need to tell your doctor. And I have a few tips for you to improve your gout symptoms. First is regular exercise and drink more water. And limit soy products like stinky tofu and drink less alcohol or don't drink any alcohol and drink less hot pot soup or chicken broth and eat less high calorie foods and control meat intake. Yeah, and I want to tell you that to sum up, I have some questions to help you review all the boring or complex content what I had said today that might probably make you sleepy or something. What food is not recommended? You can give me 2 examples.
You really give me a lot of answer I need.
Yeah, just no alcohol.
No alcohol. They drink much. The drink the water as much as you can.
Oh yeah, more water.
Yeah.
More water is better for you.
Yeah.
And the next question is that if you feel weird in unusual situation, what can you do? You need to tell someone.
You go back
Someone
to hospital and see the doctor.
Yeah,
See
the
the
doctor,
doctor.
or you can come to the hospital to see the pharmacist.
Yeah.
Yeah. And the above is the content of today's health education. And this is, we have a health education leaflet of this medication. It has the contact information of the hospital. If you have any questions, any questions, yeah, and feel free to call me or anyone and ask at any time, 24 hours for you. We are all enthusiastic to help you. and thank you for coming today. Wish you have a nice day. And the bonus is remember what I tell you today and take a note, remind for yourself every day and change your lifestyle step by step. You will get better and better. And let's have a fist bump. Yes.
I appreciate your
Thank
over
you.
a good advice. I would take it. Okay?
Okay.
Thank you very much.
Thank you very much.
Yeah.
Yeah. I'm impressed with your conversation with the patient. And yes, you can be successfully introducing yourself and explain your purpose of coming to this patient. And especially in the fields of the drug storage and the drug interaction, yeah, you explain very well. And you are also so patient to tell this patient how to do it and what to be cautious or to know some drug side effects. So very good. Yeah.
Thank you.
OK，资深 ，Hello， 好久不见。OK, so overall, your counseling is quite impressive. So you collect a lot of information and you prepare a lot of drug information to provide to Mr. Lee, our patient, right? So yeah, including you talk a lot about side effects and also you explain about what is gout to the patient, okay,
Yes.
which is good. But next time you can try to explain it more in a more easier way.
Oh.
Yeah, because I know your concept is correct. You're talking about something, crystal things formed in his knee or in his ankle, blah, blah, blah. But next time we can try to use a more easier way to let the patient know about, okay, what is gout? And basically, I think because he already went to see a doctor, right? So the doctor had probably already explained what is gout to the patient. Okay, so what we do is we don't need to go too detailed on this. Okay,
All right.
because you can save more time for more counseling. Okay, so I like the way that you prepare a lot of information for the patient. But actually, you can when you explain one medication, you can stop and ask the patient, okay, so do you understand? Am I speaking too fast? Okay,
All right.
You keep going on and going on, right? So the patient was like, okay, what?
I need to share a lot of information.
Yeah, so,
the time is too limited.
It's kind of hectic actually. So you can stop and make sure that the patient understand what you are talking about.
All right.
You can stop to confirm this. Yeah, because it's actually more important to make sure the patient knows what you're talking about instead of giving him or her a lot of information. Okay, and did you notice that the patient likes to drink Coca-Cola?
Yeah.
So, of course, you talk about alcohol, which is good, but I think you also can elaborate more on the Coca-Cola part because the patient drinks a lot of Coca-Cola, right? He drinks
I know that.
Coca every day.
I have searched the information about Coca-Cola, but everyone said don't drink similar drink like that because it is very not good. So
not good, right?
Just can drink water.
Okay.
So I just can tell him to drink more water. Yeah.
Okay, but you can actually ask him try to cut down the amount of Coca-Cola that he drinks. Yeah, maybe he drinks 3 bottles of Coca-Cola one day. You can ask him, okay, let's try to drink 2 or maybe 1.5. Okay,
all right.
That's a good start for him to reduce the amount of Coca-Cola because Coca-Cola will also have some effects on his gout problem, right?
Yeah.
Okay, and then the last part is renal function. Did you notice the patient doesn't have a really good renal function?
如果我不拒绝他的话，就没办法打字。
I know.
Yeah. So this is actually something you can also educate the patient because he is taking NSAIDs, right? And we know that patients that are taking NSAIDs will affect his renal functions, especially when he or she is already having a poor renal function. Okay, so this is also something that you can educate and let the patient be aware of. Okay, that's all. Good job.
Okay, thank you.